When we focus on our harm reduction approach, our focus is always on recovery. But part of recovery is the environment you live in. So, I mean, who best to have these kits on hand is people that have used or that are in recovery, and they may be hanging around with other folks that are using. So they may not necessarily use it on themselves. They may use it on somebody else, or somebody may be around. Our hope is that we're training our patients on how to use the kit, but we're also inviting family members to come in or concerned partners that we would train as well. The pilot project is focusing on folks that are already connected to our services. So we would have an understanding and a tracking and be able to, okay, have you used the kit? Has the kit been used? And then be able to provide resources and supports if that should happen, right? If they were using the kits. Right? When we're looking at the kits and our clients are using the kits, if they should be used, our hope is that we would make some connection with emergency medical services to do some follow-up and support and resources for them, or provide that for them, right? Everybody that uses the kits is going to touch base with the merch anyway. I mean, we can label folks addicts, we can label them, as not a part of society, but everybody is a human being and deserves the right to a fair chance of life. And I think that's what our kits are hoping to provide, is the ability to save lives, right? And at the end of the day, I mean, there are resources and supports that we can do to follow through with that.
Once they've identified that they would like to have a kit, they're given training, and then the opportunity to have a caregiver or someone assigned to assist them also will receive the training. It's kind of to give an addict the medication without someone there. They won't be able to do it if they're in an overdose situation. So they'll need to have someone there to administer it for them. So it's really a partnership with someone else as well.